Hello, thank you for joining the California Telehealth Resource Center for Leveraging Digital Health for Disasters. As you may know, on the next slide, CTRC is wonderfully supported by HRSA's Office for the Advancement of Telehealth and the California State Office of Rural Health. Our grant information is included at the bottom of the screen. We would like to inform you that CTRC does not provide legal advice, and CTRC has no relevant financial interest, arrangement, or affiliation with any products or services that may be mentioned in today's session. And with that, I'll hand it over to today's presenters.
Thank you, Aislinn, for that intro. We're very delighted to have you all here today. My name is Sylvia Trujillo. I'm the Executive Director of the California Telehealth Resource Center. We're really delighted to have Crystal Baker join us today. She'll provide you a little bit about her background, but we had a partnership in place where she has done a tremendous amount of deep dives into the issue of leveraging digital health in the context of disaster, both in terms of preparedness, mitigation, response, and recovery. With that, I'm going to hand it over to the star of this webinar, Crystal Baker.
Thank you, Sylvia. And a little bit about myself. I am a MPH student, Master of Public Health student at Youngstown State University, but I am located in California, sunny Sacramento, California. And I've done a lot of work here, working with various nonprofits, with boots on the ground efforts, as well as higher level working with state entities to increase health, access to healthcare. Today, we'll be discussing various digital health tools in the context of disasters, and we're going to start with how disasters have increased and what their impacts are on the healthcare system. We'll also discuss some overall challenges for disasters, the need for comprehensive plans, as well as what data we were using and how we collected it. And then we'll go into some major findings of that data collection regarding the literature review, as well as the key informant interviews. And we'll wrap things up with some solutions and resources for you to implement. All right, so diving into it, natural disasters are increasing, and because of various environmental factors, they are becoming more severe. And so that has caused some vulnerabilities that highly affect the healthcare system. And one of those are infrastructure. And infrastructure can include power outages, internet failures, and even transportation issues from disasters. And these all impact healthcare delivery. These vulnerabilities then in turn cause strains on the healthcare system, and these can include resource strains, personnel strains, as well as financial strains. And that's why it's so important for there to be proactive disaster planning with digital health tools incorporated. And this really helps with operational resilience as well as patient care continuity. So next, we'll look at overall challenges for disasters. We mentioned a little bit about the infrastructure, but we also found through our research that communication was a huge challenge. And it wasn't only internal communication, but also external. So this ranged from interdepartmental communication all the way to organization, such as a hospital to county directive or EMS, first responders, things to that nature. And then coordination, the lack of coordination among agencies and providers also showed a huge challenge as everyone's doing this work to support the healthcare system and patient outcomes. Everyone, it seems like there's a lack of coordination and they're doing this work in silos. Lastly, we have the inequitable access to care, and especially in underserved areas, they were further exacerbated by disasters. And so many plans do not integrate digital health technology, which limits operations during disasters. And this will kind of bring us to our next topic.
Crystal, before you advance, just really quickly, one of the things I'd like to dial into is in your surveying and investigating, And looking at the challenges, were the challenges more significant or different for rural communities? And what are the issues around connectivity?
Yes, that was a huge finding. And um, it's trying to sum this all up and make it into a pretty package for providers and for uh, operation staff. Rural communities were significantly impacted, and so because of already existing challenges in day-to-day care, these were then exacerbated and created even worse challenges. And there's multiple studies showing how demographics based on uh, where they lived, as well as race and ethnicity, income, they all were heavily impacted. And so, to answer the second part of your question, yes, connectivity was also a big factor in this as well. And we'll get into some solutions on how we can help with connectivity at not only the inside the hospital, but how we can be proactive and help those patients um, and meet them where they're at and help them guide them to use digital health tools.
Mhm.
And so that brings us to the need for comprehensive disaster readiness plans. And these plans can focus on not only the preparedness aspect of things, but also the mitigation and recovery aspect. And the lack of integration of digital health tools really limits the plan's ability to respond effectively to crises, including digital health tools like telehealth, HIPAA secure texting, remote monitoring can bridge gaps in care during these disruptions. And so telehealth specifically can address non-urgent cases remotely, and this then in turn reduces the strain on ERs and hospitals, as well as remote monitoring ensures high-risk patients ensures that they continue receiving care even during infrastructure failures. And HIPAA secure texting also is the lowest tech, as well as requires the least amount of connectivity. And so it's also a wonderful tool in downtimes. And digital tools provide scalable solutions that can really adapt to various disaster scenarios and severities as well. Proactive deployment of DHT can improve the speed and efficiency of disaster responses, and a robust plan that integrates it allows for better communication among healthcare providers, emergency responders, and stakeholders. So really look addressing some of those challenges that we just discussed. And so what does telehealth mean, right? Everyone has such a differing definition of telehealth, digital health tools, and that's what the research found as well. There is a lack of standardization of terminology and definitions, and this creates a ton of ambiguity in the research when discussing these tools. And so we wanted to define it using CTRC's somewhat already existing definitions. And these definitions align with what the reimbursement criteria are to help ensure clarity, consistency, and in the research and deployment. So we had to go through the research and kind of reclassify based on these definitions. And so when we talk about telehealth, we are discussing audio and video or audio only communications from provider to patient. Store and forward can be the storage of data, which can include portal messages, images, data scans, tests. We'll see a lot of portal messages being used and discussed in some of our tactics. E-consults can be asynchronous or synchronous, provider to provider communications. Day to day, they're typically asynchronous, but some of the literature really focused on frameworks that were a little newer that focused on synchronous e-consults. We also have remote physiological monitoring and remote therapeutic monitoring. And these both are remote data monitoring, which can be used with the physiological aspect, devices, wearable devices that can include blood sugar monitors, things like that. And therapeutic data was really focused on compliance, medication, things to that nature. And lastly, again, that HIPAA compliant texting, which is secure provider patient texting. And so, with all of the data we found, we used two approaches. One being the literature review, and one being the key informant interviews. And with the literature review, we looked at existing research and identified trends and gaps in digital health tools applications, as well as reviewed various usage in other disasters for these digital health tools and highlighted areas that could be improved in disaster response. For the interviews, we conducted 5 interviews with subject matter experts and explored their experience with digital health tools, specifically in disaster contexts, as well as we were able to identify some barriers and solutions from expert perspectives. So, diving into the literature review, we found that these 3 main modalities were the ones that were studied the most. And not to say that the other ones aren't valuable, it's just these are what have been studied the most and were most reoccurring in the literature. And so telehealth was found to be very crucial for maintaining care and reducing ER visits. Again, that an upstream solution so that we can make sure that patients are continuing to have access. And this was also really good for high risk patients or those that had barriers such as like transport or maybe disasters cause some road damage. Store and forward, this specifically was focusing on the messaging, and providers were able to use this to reroute and reschedule patients efficiently during disruptions, as well as provide some real-time updates on office operations. So say a disaster left one office inoperable, they could then reschedule and or reroute them to a facility that was open and providing services. Lastly, we have the e-consults, which were used to reduce errors as well as assist with tasks that kind of helped mitigate with some of the shortages on personnel as well as specialists. And this allowed for the reallocation of workforces that were outside of the disaster affected area to then help assist with care.
Crystal, before we move forward, just want to focus on a couple of items under the literature review. So looking back at this, the first thing that strikes me under telehealth, heat-related deaths are probably the highest sort of mortality of any disasters. To what extent did you see in the literature a discussion of using telehealth, maybe to divert care during an extreme weather event, whether it's, a blizzard, flooding, or even heat, where the road might still be in place, but where the risk is really high for a patient, particularly fragile patients in terms of telehealth? Did you see examples of that in the literature as being an important option under those scenarios as well?
There was options of, yes, some options of telehealth being used for some of those populations, such as there's older senior demographics that were being used. Again, they're very susceptible to heat and some of the weather environmental factors that can impact them. And so there was some instances on that, but again, it wasn't super highly present in the studies. Um, it was more of a supplemental finding than a main finding, but still very valuable and still a tool that can be implemented to treat maybe the seniors that are more heat adverse than, or there was actually an instance of using telehealth in cases when there is bad air quality, especially with asthma or respiratory patients. And so that was one way that telehealth was used.
So this scenario would be there would be a poor air quality alert, and so an in-person visit would be converted to a telehealth visit.
Correct. Yes.
Excellent. And then on the e-consult, that's really fascinating. I mean, they're all fascinating, but I'm particularly fascinated by the notion because typically, in a non-emergency situation, e-consults are between a primary care clinician and a specialist. And it sounds like these e-consults might be between not necessarily a specialist, but someone with more specialized training, and could be another primary care clinician, or even if you're talking about medication, it could be pharmacists that are trained on medication management, um, medication therapeutic management rather. Um, and it sounds like they're being deployed to help maybe allied professionals who might be on site augment their expertise through e-consults, which is fascinating and it's something I hadn't even thought of.
Yeah, and actually, it was very new. It was much newer research with the e-consults, as there was new frameworks that were being tested as far as how can they utilize these specialists or even just other primary care physicians or supplemental staff that aren't on in person, but can also help mitigate demands of you know regular care, and that's now been exacerbated by the disaster. So having the you know operational or administrative barriers such as approvals or dosage verifications, things like that, that could then be done through an e-consult instead of someone on site.
Fantastic.
For next, we'll go to the interview findings, and there was four really critical findings. The transcripts of these interviews were coded, and these are the four themes that were present. And so we're going to start with coordination of systems and organizations. We mentioned this previously, but it was a highly relevant and present theme in the transcriptions of the need to coordinate among the different organizations and emergency services, because there's such a lack of coordination even between hospitals and rerouting patients that maybe have burns to a hospital that doesn't have the right resources or personnel to treat burns effectively. um, and so simple things like that that can be then really catastrophic during disasters, which simple coordination and then communication, which is our next one, can solve. Communication improvements. This was internally as well as externally, and focus between whether that's interdepartmental staff or from organization to organization, such as the hospitals to Red Cross or EMS to the emergency departments and so on. Next, we have proactive solutions. And so this was one that I wasn't necessarily expecting and kind of surprised me when I was discussing. And so there was a lot of discussion around deploying these tools before the disaster strikes. And currently, there was a lot of talk of currently how digital health tools are not implemented effectively in day-to-day care, which makes it even harder to utilize in times of disaster. And so that can also mean, making sure that your patients are familiar with the portal, or they know how to use telehealth or things like that. As well as there is mention of using data that is already on EHR, things like that, to predict risks and improve resource allocation. And then additionally, operational barriers. So there's mention of insufficient education, resources, as well as um, infrastructure, which we've mentioned before. And I really liked this quote. And this quote says, communication infrastructure within the hospital system are things that hospitals are required to do to maintain their certifications. Everyone's checking off the box. I don't know how many places have actually seen whether their staff understand and can operationalize what is intended to happen. And so this is plays into all of these aspects, especially the proactive solutions and operational barriers. And we may have these great plans, and they if the staff do not know what to do in those moments and don't know how to implement not only digital health tools, but your regular disaster response plan, it can be catastrophic. And it's much too late to be responsive and be rather than being proactive.
Yeah. So, Crystal, I think to that point, it's notable that most of the funding for disaster preparedness, or a significant amount, actually is centered around hospitals who partner with other healthcare providers. So, as a note to both hospital providers who are listening in, as well as those who are in rural health clinics, community health centers, that we'll talk about at the end some resources that can help support your disaster readiness. And CTRC will be having some materials that you can look for to help support your work if you're not eligible part of the federal funding directly, unless you're in partnership with hospitals. But this does speak to this importance of tabletop exercises, which we'll also cover at the end, that you can have all the right people in the room to develop your plan. You can have digital health part of your day-to-day workflow, but if you're not actually practicing for a disaster, when the disaster arrives, the wrong time to have that disaster exercise is when it's at your front door or knocking it down. So that's a great quote, and it's a good one to remember.
Exactly. And that was said perfectly. And so some of these solutions that Sylvia mentioned, specifically looking at strengthening communication, you can utilize things like encrypted messaging, satellite phones, and offline data sharing that can bridge gaps. Um, Enhancing connectivity. We have portable Wi-Fi hotspots, satellite internets, and mesh networks that can work in connectivity downtimes. Um, Although maybe not everyone has the resources to invest in that, there's some other offline digital strategies, such as offline capable EHR and telehealth platforms that can be utilized in downtimes, but then will sync once connectivity is reestablished. And lastly, we have what we have mentioned multiple times throughout this is proactive deployment. And pre-deploying telehealth, patient tracking, remote monitoring before the time of disaster is going to help significantly during the disaster when they don't have to have that learning curve in the middle of chaos. And so going to the tabletop exercise that she mentioned,
So, Chris, before you do that, I want
yes.
to ask if we could go back to that
Mhm.
slide. Just, I want to pull out a couple of things from what you observed. And the
Mhm.
first is when you say we, you really mean you, right? I mean, you have available to you some options. CTRC does not offer these as services, just full disclosure and clarity. But um, as solutions that you've identified, that your literature review and your informants have shared, these are ways, right, to
Mhm.
that you can look and research and find out. And again, we have some tools to help you think through what resources and tools you need in place. And these are just some of them. And the other is just on the proactive deployment. Not only Crystal's going to review tabletop exercises, which are important, but there's also an opportunity to think about each patient and identify proactively when you establish a patient and as you're maintaining a patient, what interventions might be appropriate for them in a disaster, whether it's a HIPAA compliant texting notification that goes out if they have respiratory issues and there's poor air quality, if they're a medically compromised individual that may need remote management of their care and making sure that they are prepared to roll over to that modality if they're not already receiving that service during a disaster. But it's that kind of looking at your patient panel periodically, having a means of identifying patients and the kind of interventions that'll work for them so that you're not making that assessment when the disaster occurs, but that you're thinking about your patient population holistically, periodically, to ensure that you are thinking about the most common disasters that you could prepare for.
Exactly, exactly. And one of those exercises and tools that you have is tabletop exercises. And these really strengthen the disaster response by integrating these tools that we're discussing today into your plans. And so these tabletop exercises can involve emergency department heads, IT and telehealth specialists, operational managers, public health officials, clinical staff, communication coordinators, any of the key stakeholders that help develop and not only develop, but implement these disaster plans. And they can be as short as a half a day, they can go longer, but it's really great because it allows for incorporating interactive components to make sure that staff know what to do during these times of disaster. And it's not just here's this massive book in a binder, and this is what you need to do. And so making sure that they can apply those plans to the situation really is helpful with the tabletop exercise. We do have a sample of a agenda of a half day training for the tabletop exercise. So starting with, a welcome, going into understanding what disaster risks are in California, or if you're in a specific area, diving down into what can actually happen in your area. And then scenario planning and role assignments. So that way you can, if you have earthquakes, wildfires in your region, what does that look like in your region? And what are some of the infrastructure or the challenges that are going to be more prevalent for your staff during those times? And then you can go into those tabletop exercises specific to the disaster. Sylvia, is there anything else you want to add? I know you're a big proponent for tabletop exercises.
Yeah, a couple things. For all of you, you don't have to make this up out of whole cloth. There are several organizations, including the California Hospital Association, which has a significant number of offerings to help prepare for disasters. We will link to those for you following this webinar. We also have a resource page for disaster readiness and preparedness and response. The California Primary Care Association, for all you community health providers, also has a free guide that also points to the work that you can do to prepare for a disaster and the specific challenges and the differences. A community health clinic looks different than a hospital in the state of California, and rural communities have different challenges than urban communities. And so we'll have resources available for you on those particular areas and issues that you need to address. And I would be really remiss if I didn't address two more items. The first being California's Office of emergency and disaster preparedness and response. We will have links and materials available from them, of which we consulted a significant amount of their content, and we are looking forward to working with them. The other issue I want to raise is funding. This is the rate limiting factor, both in terms of having the time and resources and staffing in order to do a tabletop exercise. We will have information around both local funding and resources available, as well as state resources available for you to either participate in existing tabletop exercises involving communities and regions, or where you can, with other community health providers and organizations, host a tabletop exercise. And really, what we want to underscore here is digital health is a component of a larger plan, like Crystal started the conversation. Having said that, it is an essential component that should be included, and too often is not, because it isn't integrated into the everyday infrastructure and workflows of providers, particularly, for example, remote physiologic and therapeutic monitoring, which doesn't have widespread uptake, but could be extremely impactful. But it's not one of those things that you can flip a switch and immediately staff and patients know how to use their devices and how to link up, especially during a disaster. So some thoughtful planning in advance, preparation is really critical.
You stole the words right out of my mouth here. That yes, digital health technologies can are essential and can truly transform disaster response. And it improves the all of the aspects that were mentioned today: coordination, communication, equity. And so I encourage you to not let your education end here with this webinar, but continue on and look into the resources. And there's many resources on CTRC's website, but all throughout online. So if you're interested in learning more, please visit their website. And again, thank you so much for CTRC for working with me and learning all of these critical findings.
And we'd like to thank Crystal Baker for this collaboration and the incredible contributions that she's made so generously. And it has enriched not only our understanding, but really improved the depth of content and offerings that we can provide to you. And we really welcome the opportunity to have you not only visit our website, we provide technical assistance, and we would love to hear from you all about your areas of interest in the context of digital health tools and disaster readiness. Thank you, Crystal. Really superbly done, and we appreciate all that you have done, not only for CTRC, but for all Californians. Thank you.
Thank you.